In this video, I'm going to demonstrate what a shockwave treatment is going to look like when we're treating an Achilles tendonitis. So with an Achilles tendonitis, what we're going to do is we're going to be treating the gastroc and soleus muscle, which is going to form the Achilles tendon. And so we're going to treat the muscle belly first, and then we're going to actually treat the painful tendon itself. What it's going to feel like when we're working on the actual muscle belly is just some dull achiness when we go over an area that's really tight or there's a knot or a trigger point. But then it's going to feel really good and loose after we're done, and that again is going to take a lot of pressure off the Achilles tendon. Now we're going to demonstrate the shockwave treatment over the belly of the muscle. So as we're doing the treatment, we're scanning the tissue for any trigger points or any knots. And if we find any of those, we're going to kind of concentrate the treatment on them until it releases and loosens up. How does that feel? You're okay?
Yep, I'm okay.
Now we can increase the amount of pressure depending on how tight somebody is, and until we get to a point where we feel like we're breaking up that tissue and helping to loosen up the muscle. A typical treatment of an area takes anywhere from 2 to 3 minutes, and then we move on to the next section. So in Renee's case, I feel she has some tightness on this medial side of the gastroc here. So we're going to kind of concentrate a little bit more on that area here. Now again, as we're doing this, if we hit an area that's really tight, again, patients will feel a little bit more dull, achy discomfort in that area, but that's actually okay. That's actually confirms that there is a problem in that area. And then once we're done, it'll feel nice and loose and help to get the pressure off that Achilles tendon. Okay, so we're done with the first portion of the treatment. So we treated both heads of the gastroc and the soleus muscle. Now what we're gonna do is we're gonna focus actually on the Achilles tendon. Now we're gonna change treatment heads so we can get a little bit deeper into the actual tendon itself. And if there's scar tissue in there, what the shockwave is gonna do, it's gonna help break up that scar tissue, get the blood flowing into that tissue to help it repair itself. So Renee, after doing the treatment on your upper calf portion, what does that feel like? How would you describe what that treatment feels like?
So it feels kind of like a gentle tapping on the skin, and then over certain areas I could feel like an achiness deep within the muscle. It was not painful, but you do feel sort of an achiness when in particular spots. Yeah,
once we get over an area where there's some scar tissue or there's a trigger point or a muscle knot there, an adhesion, you'll feel the achiness in that specific spot, but that's actually confirmation that that's the problem area. And basically we concentrate until we feel like that releases and loosens up, and then we go on to the next section. And same thing when we get to the actual Achilles there, we'll get over an area where there's some more scar tissue, and it'll be a little bit more sensitive over that area. But that's, again, breaking up that scar tissue and getting the blood flow into it so it can repair itself and heal. All right, so now we've switched treatment heads, and we're going to turn on the machine again, and now we're going to be focusing more where the muscle turns into tendon and where the Achilles tendon attaches to the calcaneus. So again, we're going to work those areas. We're going to kind of find some of those tender spots, and then we're going to release them using the shockwave. We're going to work both sides of the Achilles because with the Achilles tendonitis, often there's issues on both sides. She has a little bit more tightness on the inside portion. Now again, it sounds really loud, and basically what's happening in the treatment head here is there's a piston that's coming here, hitting the treatment head and then creating a sound wave that goes into the tissue to help break up that scar tissue. The actual treatment itself though, again, you feel like a tapping sensation as it kind of gets in there, and just a dull achiness when you hit an area that's really sensitive or tight. But then that's what, again, helps release that tension, where normal muscle tissue, you really shouldn't feel anything, just a little bit of a tapping kind of sensation there. And again, the treatment for this portion of the Achilles takes another 2 to 3 minutes. So in total, you know, a typical treatment time is anywhere from 5 to 7 minutes, depending on the size of the body part. Okay, So that's the treatment for the actual tendon itself. But that's what a typical treatment for Achilles tendonitis looks like. If you are suffering from Achilles tendonitis, especially if it's chronic, 3 months or more is a great time to use a treatment like Shockwave, because what's happened at that point is it's turned from a tendonitis to what we call a tendinopathy. And what that means is that connective tissue has become really weak, and there's lack of blood flow into there, and often there's scar tissue that's formed at that point. And that's what leads to this chronic nature where it'll come and go depending on how much stress is on the tendon. It can flare up and become very painful. Well, what this is going to do is going to break up that scar tissue, get the blood flowing into the tendon, which is going to help it repair itself. So if you're suffering from Achilles tendonitis, give our office a call at 703-912-7822 or schedule online at novacarewellness.com.